Welcome to New Hampshire's Business. I'm Fred Coker. New Hampshire is one of the oldest states in the country, one of the 4 oldest. By that I mean the median age of our population is just north of 41. But that is affecting one particular business in New Hampshire, namely hospitals, and we'll get to that in just a minute. But let me tell you about the aging of New Hampshire, and here it is. Looming geriatric tsunami in New Hampshire. New Hampshire's shift to older population reaches its peak in 2020. 500,000 citizens over the age 65 by 2030. That's 1/3 of our population. The trend will affect healthcare sector the most. There are only 50 beds in New Hampshire for geriatric psychiatric care. Now, here's the hospital that's dealing with this. Frisbee Memorial Hospital in Rochester preparing for the tsunami of geriatric care, creating its own outpatient surgery center, partnering with Dartmouth Hitchcock, Elliott Health Systems, Harvard Pilgrim Healthcare, and with me is the CEO of Frisbee Hospital, John Marzinczyk. Welcome.
Good morning. Thank you very much
for having me. Nice to have you here, John. You were quoted in Business New Hampshire magazine, which did a piece on this, saying that you see a tsunami of geriatric care coming our way. Just frame that for us, from where you sit.
Starting in 2011, 10,000 Americans turned 65.
Yeah.
That trend's going to continue through 2018. 30% of those Americans are going to have some form of dementia.
Yep.
In the state of New Hampshire, as you mentioned, we now have 50 beds. 20 of them are at Frisbee. We started the geriatric psych unit in 1984.
Mm-hmm.
And if you think that you're going to be able to manage that population with your existing patient base, it's a very different skill set needed to manage.
What are you doing to prepare for this tsunami, particularly because I know you want to be a leader in this geriatric area?
Absolutely. We employ 3 geriatric physicians. In the country last year, there were only 52 geriatric psych physicians that came out of residency in the country. And we have 3 full-time physicians. We have 2 mid-levels to deal with this. We have a strong outpatient program. We adopted that program as one of the strengths of the hospital, knowing that the population is only going to get older.
Yeah. What's happening in the rest of New Hampshire with the other parts of the healthcare system? Are they gearing up for the same thing?
Not really. There's only 2 other hospitals right now that have geriatric psych beds. And when you look at the families today dealing with younger kids, now they have mom and dad in the house as well. And there are very minimal resources to help families adapt to the geriatric population and the specific healthcare needs they require.
And you're seeing an increase in geriatric care right at your own hospital?
Absolutely,
going
yes.
up year by year?
That's correct.
Okay. Now, one of the things you've done to deal with this also is to collaborate, and you've collaborated with Dartmouth Hitchcock, Elliott Health System here in Manchester, and Harvard Pilgrim, and a new healthcare company called Benevera Health. What led to that collaboration, and what will that do for you?
Benevera Health is a population health management company. It's not an insurance product.
Right.
It's a program to help manage those higher utilizers of healthcare.
Okay.
And the key to it is that we're going to be doing extensive data analysis and doing projected health analytics so that we will be able to identify patients that are going to need significant healthcare services before the illness even develops.
Before it develops?
That's correct.
That's significant. And
that's
a real change.
Yes, it is.
Now, one of the things you're doing outside the hospital, which I think is fascinating, and this goes to education, you are mentoring students at Spalding High School in Rochester to develop a medical mentoring program to teach the students about the jobs and the skills you need at your hospital. Just talk about that.
Exactly. One of the nurses we have down in same-day surgery brought that up. Her daughter is one of the students. And you know, when you look at a hospital, it's like a city within itself. And students going into college, they don't know what healthcare requirements are, what skill sets may be needed to develop a career in the healthcare systems. So we're setting up a program where the students actually come in, they will be teamed with employees, spend a day or 2 or longer in the department working side by side with the staff. And we're not looking at just nurses and radiographers and ultrasonographers, the technical side. We're looking at biomedical technicians. We're looking at the skill sets needed to be even a maintenance person in a facility of this large.
Right. And we're out of time. But that goes to workforce, which is a significant issue in this state, as you know. And John Marzinczyk, CEO of Frisbee Memorial Hospital in Rochester, thank you.
Thank you very much.
Nice to have you here.